Although AEDs may differ slightly, there are universal steps for operating an AED. First, turn on the AED. Open the carrying case or top of the AED. Then turn the power on. Some devices will power on automatically when you open the lid. The AED will guide you, but it's still critically important that you know these steps. Some AEDs may have adult and pediatric pads. Make sure you use the pediatric pads on anyone younger than 8 years of age. Peel away the backing from the pads. Following the pictures found on the pads, attach the adhesive pads to the victim's bare chest. If multiple rescuers are present, one rescuer should continue chest compressions while another rescuer works to attach the AED pads. Place one pad to the side of the left nipple in the mid-axillary line. Place the other pad on the victim's upper right chest, directly below the collarbone. If instructed by the AED, clear the victim and analyze the rhythm. Be sure that no one is touching the victim, not even the person in charge of giving breaths. Ideally, you will pause CPR during or immediately after a set of compressions. Some AEDs will tell you to push a button to allow the AED to analyze the heart rhythm. Others will do that automatically. The AED may take about 5 to 15 seconds to analyze the rhythm. The AED then tells you if a shock is needed. If the AED recommends a shock, it will tell you to clear the victim and push the shock button. Again, be sure no one is touching the victim to avoid injury to rescuers. Then loudly state a clear the victim message. Perform a visual check to ensure that no one else is in contact with the victim. Press the shock button. The shock may produce a sudden contraction of the victim's muscles. As soon as the AED gives the shock, immediately resume CPR beginning with chest compressions. Do not remove the AED or turn it off. The AED will repeat the analyze and shock cycle every 2 minutes. When the AED indicates no shock advised, you do not check the pulse first, you immediately start chest compressions again. In a moment, you're going to be tested on your skill in 1 and 2 rescuer CPR. Right now, we're going to show you the entire sequence of child CPR, including assessment.
Hey, are you okay? It's not responding. It's not breathing. You activate the emergency response system and bring an AED back. There's no pulse. 1, 2, 3, 4, 5, 6, 7, 9, 10, 11, 12, 14, 15, 16, 17, 18, 19, 2, 3, 4, 5, 6, 7, 9, 10, 11, 13, 14, 15, 16, 17, 18,
Attach pads to patient's bare chest.
3, 4, 5, 26, 27, 29, 30. One, 2, 3, 4, 5.
Plug in pads connector next to flashing light.
12, 13.
Clear.
Analyzing heart rhythm. Do not touch the patient. Shock needed. Charging. Stay clear of patient. Press the flashing button now.
Clear to shock on 3. 1, 2, 3.
Shock delivered. Begin
1,
CPR.
2, 3,
Start
4,
with
5,
compressions.
6, 7, 8, 9, 10,
11, 12, 13, 14, 15. 1, 2, 3, 4, 5, 6, 7.